Welcome to Veteran Voices, SITREP, with your hosts, Tom and Chris Faust.
Welcome to Veteran Voices, SITREP. We are your co-hosts. I am Tom Faust, and this is my son, Chris. And today we're going to talk about alternative therapies and benefits for emotional expression and healing, particularly for veterans dealing with PTSD and other mental health challenges. And this is actually kind of a multi-part thing where we'll probably have additional episodes. For today, we're going to talk mostly about art and music therapy. In the future, we may get into equine, yoga, mind-body connection, things about nature and the outdoors, that kind of stuff. So we look forward to actually having a little more on this topic, but art and music today, I think, is going to cover quite a bit for us. So we want to start by discussing ways that you can find healing through art and music therapy. And of course, we'll provide links as usual. And I think I have quite a few resources we can share with this. Chris, would you like to start out with something?
Yeah, so art and music therapy, it's really fascinating what it can kind of what it can do for you. It gives you different ways to express, and it can be both non-verbally, which is typically you're going to be your art therapy, but there's lots of different kinds of art, so it could be verbally as well. But when you think artist, you think, some sort of, drawing or crafting or something like that. So when you think about art therapy and you look at the emotional expression of it, kind of allows for expressing your feelings that you may not be able to put into words. So you might not be able to explain what's going on in your head or what you're feeling, but you might be able to draw, you could draw some kind of picturesque, thing like, storm clouds or, a field or, just anything like that to kind of put your feelings onto paper in the form of a, design or art.
And it could be good for reducing stress as well, even for anyone. Art activities like drawing and painting and sculpting, like you mentioned, just the act of doing it, it puts your mind on something else. So you stop whatever you're worrying about, and you can actually reduce stress levels. And this has been proven to reduce stress and promote relaxation.
Yeah, and another part of that too is it can also kind of improve your self-esteem, because obviously when you're stressed out, you start to have doubts about yourself, regardless of whatever it could be. So creating art can kind of enhance your self-worth and your identity. It can provide a sense of accomplishment. Boosting your self-image. And that could just be anything from you created something from nothing, just thoughts swirling around your head. And it could come out to be something just absolutely fascinating and fantastic. You're like, wow, I didn't know I could do something like this.
Mm-hmm. Yeah. And it helps kind of give you a sense of self-awareness. Like a lot of times you have feelings deep inside that you really don't know how to express in words, but you can actually let that come out in your art, in drawing or painting, or even acting things out, where you want to be able to say it, but maybe you have to play a role in order to do so.
Yeah, that's art therapy is good for things like that. But one part of the next part of this that is near and dear to my heart is music therapy. Now, this one I can completely relate to because over the last few years I've been struggling a lot with. Maybe a little bit of anxiety here and there on things, but mainly a lot of sadness and depression, losing pets. I don't have kids of my own, so pets are like my kids, and losing them hurts. Losing family due to arguments, things like that. It just kind of, really kind of put my head in a bad spot. And that's one of the things that I can be thankful for when I joined the barbershop course that I'm a part of is music is extremely healing. So this gives me an outlet for, to focus my mind on something else to try and reduce my anxiety and stress by, singing and focusing on the music that I need to learn, and, for actually performing. So it's been a huge boon for me, from a music standpoint and from a feeling standpoint, as it really helps out.
And that really does make sense because music has been shown to stimulate, these neurotransmitter things that can improve your mood and your emotional well-being. And also it can improve your communication skills. You can express your thoughts and feelings through music, through not just words of music, but even in the sound of the music, the kind of music that you might come up with if you're just learning to play an instrument and just being creative with it. All of this can really help communicate feelings and just getting like anything, getting things out improves your mood and helps you get past any kind of emotional issues that you might be going through. Right.
Yes. And coping with symptoms is another part of this that really helps because it's when you perform musically and you're performing for an audience, they paid to see you, or you're giving your time for a cause. But when you perform, when you sing, you want to express, kind of the mood, the feel of the song, whether it's a happy, upbeat song or a very, very somber, meaningful song. And how music can help with that and with your feelings that's why you get a lot of actors and, vocalists and things that are really good at what they do because they can take themselves to the edge of an emotion to where you can feel it in what they are singing, performing, doing without actually kind of going over. So it helps you cope with things, whether it's, your depression, any cognitive disorders, mental health conditions, by helping you be able to know and identify when you are kind of reaching that point where it's like, okay, I'm kind of getting there and I can express what you are feeling, what you are wanting to do so you can express in music without, getting into that headspace. You can kind of get there and release that without letting it take over.
Yeah. And so I would like to kind of move this into how someone can incorporate their art or their music, their creativity, into a routine that will actually help them stay on an even keel, to actually kind of be able to maintain without getting too deeply into depression, into any of the worry and concerns that they might have. And a lot of times it requires looking for professional guidance, getting some kind of therapy, but you can work with therapists that are that they specialize in art and music, and they're certified for this purpose. And they'll explore things like specific mental health concerns, and they do it in a structured and therapeutic setting. Sometimes it's on an individual basis, and oftentimes it is, most likely in a group situation where you can bounce ideas off of other people and have other people that are in a similar situation that understand where you're coming from. And it makes it a lot easier to express these feelings.
Yeah. And then there's, for those of us that are, the stubborn kind that don't want to go for professional guidance, that's when you have your self-directed activities, which is, when I perform with my, barbershop chorus or sing with my quartet, I can engage in these activities, at home or, in public performing. If I was a painter, I am not artistic by any means, so I can't paint. I don't really put words down very well with what I'm feeling, so I'm not very good at journaling, but journaling, playing an instrument, listening to music even, that resonates with you, can help with that. And then using these forms as, mindful practices for, to focus on the moment and while creating or listening, to reduce your stress, improve your mental clarity. And it gives you an outlet to put out the feelings there so they're not being bottled up. That's one of the biggest things about any form of therapy, is that you're finding a healthy way to process and reflect without keeping it in and letting it crush you that way.
And there are times for everyone where it's a lot easier to do this on your own, to express these things individually. There still really is value in the group sessions and participating in, like, if you want to do that, you can be in a musical group and be able to share your experience with others, playing other instruments, possibly singing other parts with you and working together. And that camaraderie helps to bring things out and to feel a part of something else. And you can integrate this music therapy or art therapy into your life. And this can really help build the creativity of other parts of your life and just things around you and how you work with others and just improve your overall well-being.
Yeah, I actually really liked what you used when you said camaraderie, because that's exactly what, singing with a group, for me is you have other vocalists and musicians that you're with, that they share, you share a connection with them in a different way than you would with your family or significant other. It's well, since it's an all guy chorus that I'm in, so it's like a brotherhood, and everyone's going through their own things and everyone's expressing their own feelings through music as well. So yeah, I like camaraderie. That's a very good word. I didn't think of that. It's like, oh, I should have.
Well, so let's talk now about how veterans can use art or music to communicate the experiences and things that oftentimes are very difficult for them to talk about, to get out verbally. Because a lot of times you carry experiences from your service that are either really personal or more often probably traumatic. If you've been into particularly if you've been into any kind of a combat situation, there's a lot of things that you have gone through, seen, done, whatever, that are hard to deal with and hard to talk about. And a lot of times this ability to paint or draw pictures of it, or to express it through words, through writing a story, or even just journaling, or through music, through singing, through writing songs, through just singing other people's songs that you can relate to. All of these things can help veterans deal with a lot of these things that are very difficult to hang on to and to express, but it helps you get it out. And getting it out is really the key, because holding everything inside just burns you up. It's not good for you, but getting it out of you one way or another. Yeah. And it's just a way for you to gain some clarity, it's a way to recognize what these feelings are within you and deal with them.
Yeah. Nonverbal expression follows right into that. It's being able to find a way to express something without having to talk about it. You process it internally, and then it comes out on whatever you're doing: drawing, painting, sculpturing, even photography. You might be feeling a certain way, and then you might see something, off in the distance as you're out and about, and you're like, oh, wow, that really kind of relates. And you just snap a picture, or you take multiple pictures that you can look at later. And, it's really fascinating how the mind works with certain things.
Fact that you're taking a picture of something, but there's the editing software that you can use to tweak a photograph to modify the colors and the shading, or even change the backgrounds on things to really represent what's going on inside of you. Yeah, and these things, like through it's you can create symbols and metaphors that express these complex emotions. The symbolic language, that kind of helps communicate issues and things that relate to your service, and combat experiences and loss, and things that you find a hard time dealing with. It can be just a way of creating these expressions and getting it out there.
Emotional safety is another, really good way of why people will go, the art or the creating route, where they don't actually have to, that it's very personal and introspective. It's very, what you're feeling, and you can engage with the emotions at your own pace, and you don't have the pressure of having to explain or justify why you're, justify the feelings. You don't have to explain them. It's just, you're in your own thing. It's safe. It's non-judgmental. You can explore your own feelings however you want. You can express them how you want, and you don't need to explain it to anybody. If anybody sees a painting or that you might do or something like that and asks, you can be like, oh yeah, I just felt like creating that one day and did. No explanation is. You know the reason why. Other people don't need to.
Sure. And this works as a way of releasing pent-up emotions and things inside of you. It can really help in the healing process, because you externalize, like you said, externalize it through the experiences, through art, and nobody else has to really understand what it's about, but they'll get their own expressions out of it and their own feelings for it. And veterans can gain a real good sense of control of their memories if they use this to share the experience in their art. And you can integrate these into your civilian life as you move on.
Going into that a little further too, it's, kind of creates your own, personal narrative on identity. Creating art, whatever it may be, allows, veterans, to tell their stories in a personal and meaningful way. Through their artwork or whatever they're creating, they can reconstruct their narrative, which can empower and contribute to a stronger sense of their identity and self-worth. It can also, if you go the route of, talking with somebody, art can serve as a starting point for discussions. Like you might not know what you're feeling, kind of how you want to bring it, but you have a bunch of different creations that you made, and then you bring those in, therapists, peers, family members, share and discuss the artwork. So it gives you a starting point, because a lot of people might not know where to start. They might have thousands of feelings going in their head, and they just don't know they don't know where to start. Which foot can I lead off of? Which one's the first step in a cadence march? Art can kind of help with that. It can help prioritize and process what you want to talk about, and that can also lead to deeper understandings and validations of their experiences with other insights from outside influences.
Mm-hmm. And like you said about not knowing where to start, a lot of times that's where the group therapy sessions can come into play, because maybe you're not ready to talk about something, but someone else is, and they come up with a subject that you can totally relate to, and that could help bring you out of your shell and help you to be able to express feelings that you haven't been able to express before with people who will understand. And you can share this creative process and get a sense of community and mutual support. And this is all very important things for, reintegrating into social situations and overcoming these feelings of isolation. So, the art therapy, the music therapy for veterans, there's a lot of different things you can do with it, ways that you can express it. And it really does help with understanding a lot of these traumatic memories and helping to soothe that out so that you don't keep it all pent up inside. You really want to get that out of your system, because that's the only way you're going to be able to move on.
Yeah. And like I said, I can circle back around to, music therapy contributing to well-being. It's, the structured use of music as a therapeutic tool, it involves carefully designed interventions that are tailored to the individual needs and goals. So the interventions there, they can be facilitated by trained professionals, music therapists, as you had mentioned, who use music to address physical, emotional, cognitive, and social needs. And whether that's, they're using music to, say, how do you relate to this? Or if they're just trying to bring out some sort of feeling with it. So it's like songs are very subjective when they were written or created, but they can still elicit emotions from people. Like you play a song that's going to be, sad. Like if somebody feels like they might need to, somebody needs to have a good cry, as it were. You can put on a very, very soulful, very, somber sounding song, and that could help bring out that emotion for somebody who might not normally express sadness or, frustration or anything through tears.
Yeah. And the music therapy is really, it's characterized by these interventions, and these can be initiated through, some qualified music therapists, or personally tailored as individual thing. You can do a lot of it yourself. You can even do some research online, I'm sure, to find, to look for ways to deal with these things, to ways to use music, to be able to choose the right music to listen to help your mood, to write your own music that maybe works and helps your mood and helps you release these, the stress and things in ways that are personal to you.
One part of music therapy, which I never really considered therapy, it's more just, it helped me, especially after a long and stressful day at work where I just don't really feel like doing much. I've been a huge listener of classical music because, yeah, they do have the, the upbeat stuff, but it's really a lot of just calm. I mean, it's just there's no words. Everything is expressed through the music. So I listen to classical music every day on my drive home, unless I'm, practicing, singing, songs that I need to learn and things like that. But I'll listen to classical music just about every time that I can. And it, at least I think it, helps relieve some stress, lowers the heart rate, lower blood pressure, kind of decrease stress levels, just because it's something you can focus on. That's not everything going on outside. It's just you're introspectively feeling the music that you're listening to, and then you can just kind of calm down, whether it's your heart matching to the beat or the time of the song, but just gives you a way to just calm down with yourself without having to think about the outside influences for at least a little bit.
Yeah, I agree. Classical music is very good for that. Lately, I've been putting on meditation music, which is very calming. It really is. It's just chords and notes. It's no words to it. It's very smooth transitions, and it helps keep, sometimes at night, you get your mind going and it's hard to get to sleep because you keep thinking about different things. Well, this kind of thing, the classical can do it as well. But the meditation music is just calming and smooth and just helps get my mind off of other things and helps me get to sleep easier. Music therapy can have active techniques as well. Like I mentioned earlier, with potentially, acting something out. You can use improvisation, singing, playing instruments, just being creative as you go. These are techniques that can really help, help you and help others maybe that are listening to have release of this emotional content, emotional feelings, to get this stuff out. And it's, like I said earlier, stress reducing.
Mm-hmm. And then also, if you, depending on how you want to change the music too, it can actually, help promote, cognitive stimulation. So when you're looking at there's certain music for different things, like study music. Like I'll listen to classical music when I was, going through school or trying to learn something for work, whether it's like learning, for a certification. I'd always listen to kind of like some lo-fi beats. So it's not like smooth instrumentals like a classical ensemble would be, but it's very just, I don't know. It's hard to explain. There's different wavelengths in the type of music that you want to listen to. And that goes for, the kind of music that you listen to when you're listening to your, calming meditation kind of music. There's different wavelengths that get into your head that affect it differently. So different kinds of music can help stimulate your brain, which I'm sure could be beneficial for, cognitive impairments, like Alzheimer's. I'm sure music probably helps with that too, if something to do, but it can also help with memory too. Memory and learning, it kind of goes hand in hand there, but music can either bring up memories of things. Like you can relate something that you learned or read with, maybe a certain song or a tone that was in the background that you might not even realize you did. It's like the old jingles from back in the days for commercials. I guarantee you those things were created, years and years ago. But as soon as you hear it, you might not have thought about it for years, but as soon as you hear it, it kicks back into your head. You're like, I remember every single word of that. It's extremely fascinating how music can just kind of bump your brain up like that.
Yeah, and I also find certain songs that, some song will come on the radio or wherever, and it just takes me back to a particular point in time. I could totally picture the room I was in, what was going on, the people that were around me when I first heard this song or used to listen to it a lot. And that, like you said, for memory, I think that's really a good thing. And anything that stimulates memory, that stimulates creativity, is all good for keeping your brain strong and working right. Like you mentioned about Alzheimer's disease, all these things can help prevent that and really stem it off. And then we even find that, engaging patients who are struggling in medical situations with music making and active music intervention, like, using music as an effect on their cognitive functions, like we just talked about, playing instruments engaging in rhythm activities. All these things work kind of in a neuropsychiatric way of managing the symptoms.
When you talk about wanting to kind of implement music therapy, it's, just like any sort of doctor or therapist, they're credentialed professionals who have that, kind of went to that specialization. So, you have different types of psychological processes for things. Music is just one of them. So the professionals that you would get therapy from are going to be credentialed. They're going to be approved in this type of program. And that way it kind of ensures that your therapy is, evidence-based and tailored to your needs. And then it also helps build that, client-therapist relationship. It's just like, you don't want to have to talk to a different random person every time. You want that one-on-one knowing, hey, this person has already heard all these things. I don't have to rehash it. They know exactly where I'm at, where I'm going, and how to help get me there. And then the music therapist will evaluate the progress of the individual and adapt their interventions or their strategy accordingly to maximize those therapeutic benefits.
And the research really supports all of this. And these things support the effectiveness of the music therapy and art therapy for stress reduction, cognitive improvement, all of these things that we've been discussing. They talk about the strengths and the effects of the therapy, and they identify the potential things that really work to affect improvement. And then this structured interventions, they're very versatile, and the evidence really points to improving mental health and cognitive function, as I said. Personalized and goal-oriented sessions, these therapies can significantly help your situation, and they offer kind of complementary treatment options for a variety of conditions that you may be having to work through.
Yeah, and there's, we can talk a lot about, music therapy in general, but, that just a few of the different, music therapy interventions, there's different things there. So when you talk about music therapy intervention, you have the whole big picture, and then you've got the little parts of it, which is like, you have instrumental music making. So you can, use traditional and non-traditional instruments to, create sound, which can help with, motor skills, coordination, sense of achievement. Improvisation, as you had mentioned too, where you're just playing something. It doesn't have to be written down. You're just feeling the music. You're just improvising, creating it that way. Your music making can be structured. You recreate pre-composed music and things like that. Vocal music making, singing, vocal exercises, like the stuff that I do when I sing with the chorus that I sing with. Songwriting is another way of music therapy intervention. And then therapeutic performance. This is where you can really kind of set yourself apart from random performer, and then you can get to an emotion and have the audience feel some of what you're feeling, so you can take them on the journey with you through your performance.
And for a lot of people, they may not really think that they are creative in that way, and may not feel like they want to create music or write down words or even perform in front of people. But at the same time, you can actually do intentional listening techniques to live music, recorded music, and it can still stimulate these auditory processes and things that give you relaxation and cognitive stimulation by just analyzing what you're hearing. Listen to the parts, the way the music is put together, the different instruments, especially like you mentioned in classical music. You can sit and think about the music and the creation of it, and pull out the violins or the horns or the wind instruments, the various things, and you can pick out the different parts and listen to it, and that can be very helpful as well. You can analyze the lyrics and think about what was someone thinking when they wrote these lyrics? What were they trying to express? And are you really, feeling the same thing that you think that they were intending for you to feel when you listen? And these can help connect with personal experiences and with universal themes. And then you can use the the music just to relax, just to promote a relaxed state and just help you calm down and not think about things that would stress you out. So all this is very useful in helping you just learn from even listening, not even having to perform or write, but to just on the listening side. And it can support the inner experiences and emotional processing.
Yeah, and then kind of going into a little bit of what you were talking about with music listening and trying to process things. One of the things that I heard on classical radio the other day was a director who is actually kind of going, he kind of goes behind the music of, what he thinks was what he thinks the song was, how it was written. So you have this Samuel Barber's Adagio for Strings, which is said to be one of the saddest sounding songs, like with a lot of the violins, the chorus and everything that kind of just goes in there. And then, but he looks at it as more of like there's a lot going on in the world, which could be sad, but there's the main melody of the song kind of goes up and down in a way that seems like it's on like they're on a journey. It's not, all this stuff's happening around you, but you're never in it. The melody keeps going up and down in a way that it's going through the journey, and then it ends on a positive note of hope. So listening to things like that is the song might sound sad in the background, but the main way that it progresses gives you a feeling of, okay, there's actually, hope in this, as opposed to just sad sounding, which is just fascinating when you talk about music listening therapies. It's
very interesting. Yeah. And it really goes along with the therapeutic instrumental music performance, which is a technique that's actually used to try and direct the mental functions and facilitate rehabilitation. I mean, there's ways that people actually plan this in the music to carry you in a certain direction. So that seems like very related to what you're talking about there. And then there's the rhythmic auditory stimulation, which is a specific technique that involves using a strong, steady beat to help improve the gait and timing of movement, which can help people rehabilitate if they're injured and trying to get back into normal movement. And it just really helps with various disorders that veterans face, these neurological injuries that they sometimes suffer.
Mm-hmm. Yeah, songwriting and music listening, helps with cognitive rehabilitation. When you create, you're activating a different part of your brain that you might not always use. So it helps balance out, the left brain, right brain kind of a thing. It helps balance that. And then music creates strong social bonds, and it provides a medium for veterans to express their emotions and connect with others, which is essential for emotional and social rehabilitation. And then, as you had mentioned, the rhythmic activities, tapping or playing an instrument can help with motor skills, coordination, and even muscle rebuilding in a progressive way, whether you're just tapping to a beat or drumming or, banging on bongos or something.
Yeah. And so all of these techniques that we've been discussing throughout this episode, they leverage, various inherent qualities of music, the structure, the rhythm, the melody, the emotional resonance, the way that your brain engages with these in ways that support healing and rehabilitation. And music therapy and art as well. I don't want to leave art out of this. We've been talking a lot about music, but the art therapy as well. And these can be adapted to your individual needs and the needs of veterans in particular, whether it's dealing with PTSD, traumatic brain injuries, depression, anxiety, physical injuries. And it can really help to provide versatile and personalized approaches to the care and recovery of these things. I think we've gone through a lot of stuff here, Chris, and gave people hopefully a lot to think about. And I would hope that people use art and music as therapy to try and get past these difficulties that many veterans face.
Yeah, it's one of the things of, not everything is for everyone. Like I said, art creation stuff is not for me. Music was, but that's not to say, my journey is going to be a lot different than anybody else's. So even just if veterans have not even considered these things, just it's more things to look at. Hey, let's look into art therapy. I'm going to look into music therapy. Who knows? Something might spark in your brain that's like, oh wow, this is what I've been missing. And then future episodes, we delve into, equine therapy, which is working with horses, yoga, the mind-body connection, nature and outdoor therapy. There's a whole bunch of different ones that I think we'll get into in future episodes of alternative means if art and music is not for you.
Yes, so we just want to thank you all for watching and or listening, and we welcome your comments. Please like and share whenever you can on this. Let's get the word out, because I think this is very helpful to veterans in general, and useful information that we really want to get out to everyone. So again, thank you for listening, and we welcome you back next time. And it's been good talking, Chris.
We'll see you later.
See you next time. All right.
Bye.